Are you planning to come to Russia for MBBS? Then, before you pay your tuition fees, before you trust any consultant, and before you book your flight, watch this video till the end.
मैं कुछ नहीं कर सकता मैं कुछ नहीं कर सकता मैं बताता हूँ मैं क्या कर सकता हूँ मैं क्या कर सकता हूँ यार
Because today I am going to answer the 30 most important and common questions that Indian students and parents have before coming to Russia for MBBS. But before we start, let me quickly introduce myself. Hi everyone, I am Ash and I am currently pursuing my MBBS from Russia. So I am not an admission consultant, I am not representing any university and this video is not sponsored by any university.
दे दो पैसा दे दो
I am simply a medical student sharing my own experience of studying and living in Russia along with the information that every student should know before making this decision. And I am going to be completely honest with you. I'll talk about everything from fees, NEET and university selection to Russian language, hostel life, food, clinical exposure and practical skills. And most importantly, we'll talk about NMC, FMGE and what happens after you complete your MBBS from Russia if you want to practice in India. I'll cover the dark reality of MBBS also from Russia, the things that you normally don't hear in admission advertisements. So whether you are a student planning to come to Russia or a parent trying to decide whether Russia is actually worth it, then stay till the end. And let's start with the first and probably the most important question that every Indian student has the issue. So, first question, why did you choose Russia for MBBS? A lot of students ask this question from me. So, my answer is, why Russia? Why not India? This was actually one of the biggest decisions of my life. I chose Russia because I wanted to pursue medicine outside India and I found the overall pathway suitable for me financially and academically. But I didn't come here thinking MBBS would be easy. I knew I was signing up for 6 years of medical education in a completely different country.
Yes, definitely.
And also, as you know, if I choose India, but in private colleges of India, it is very expensive. And also to get selection in the Indian government colleges, it's almost 1% only because there are 22 to 24 lakh NEET aspirants give exam of NEET every year and only 1 lakh to 2 lakh seats are there in the government and as well as a private total. Question is MBBS in Russia worth it? Let me give you the answer that most consultants wouldn't. Russia is not for everyone. Yes, you are thinking right. If you are expecting an easy foreign degree, don't come. But if you are serious about becoming a doctor, can handle living abroad, are willing to learn Russian and are prepared for the licensing process afterward, Russia can be a reasonable option for you. How much does MBBS in Russia really cost? The number your consultant tells you is probably not the number your parents will actually spend. Yes, you're right. Don't calculate only tuition. Take tuition for all 6 years and add hostel, food, insurance, visa, flights, transportation, books, and emergencies as well. I would personally recommend making a 6-year financial plan before taking admission in any country, Russia, Georgia, Uzbekistan, any country. Fourth question is Russia actually cheaper than private MBBS in India? Russia being cheap is one of the biggest selling points, but let's think beyond the first year. It can be cheaper than many private MBBS options in India, but that doesn't automatically make it financially better.
जोर से बोल के लोगों को स्कीमें बता दे.
You have to compare the complete 6-year cost, not just the advertised annual tuition fees. The fifth question is, what are the hidden expenses? Your university fee is only one part of your Russian MBBS budget. Your real expenses include accommodation, food, insurance, visa-related expenses, flights, transportation, winter clothing, books, and unexpected costs. And one expense students often underestimate is traveling home. Next, sixth question. Is NEET compulsory for Russia? Can you simply take your 12th mark sheet and fly to Russia for MBBS? No. There is an important Indian requirement. For Indian students, qualifying NEET is an important requirement for pursuing a primary medical qualification abroad under the applicable Indian rules. So don't believe anyone who tells you that NEET doesn't matter for Indian students.
ऐसी बातें करके तुम मुझे भड़काना चाहते हो क्या?
But there is one page also. If you are planning that you will go abroad for MBBS and you have not to give the license exam of India, like you want to become a doctor in other country instead of India, then in that case you have not to give the NEET. So remember that. But if in case you are thinking in future you will become doctor in Russia or in India, then you have to give the NEET. Otherwise, if you will not give the NEET and you will come back after the MBBS to give the license exam, you will not be eligible, because NEET is the major thing you have to pass before going to Russia. Next question is, what NEET score do you need? There is a huge difference between getting admission and being eligible under Indian rules. You need to satisfy the applicable Indian eligibility criteria, and then you need to meet the admission requirements of your chosen university. So don't choose your university based only on the lowest NEET score someone claims that they can get you in it with. So there is entrance exams also in some universities of Russia, and in some cases they can also take your NEET score with as well as your 12th mark sheet. So it is totally according to the university.
मैं सिर्फ लोगों का दिल बहला सकता हूँ जी, किसी के दिल में जगह थोड़ी बना सकता हूँ.
Eighth question is, how do you choose a Russian medical university? If an agent says, "Sir, this is the best university in Russia," ask him one question: according to what? I would look at the medical curriculum, teaching quality, hospitals, clinical exposure, student feedback, fees, location, and university's legal and academic status. And I would talk to students who are already studying there, not just the agent selling the admission. Ninth question: how do you know whether university is recognized or not? This is probably the most expensive mistake you can make, joining first and checking recognition later. Never rely on a WhatsApp PDF or an agent's verbal promise. Verify the institution and qualification through official sources and check the current requirements of the country where you want to practice medicine. 10th question: government or private university? Government university sounds automatically better, but medicine doesn't work that simply. I would choose the university with a stronger overall medical education rather than simply choosing the word government. Look at hospitals, teaching, academics, practical training, and your future career pathway as well. My 12th question is MBBS taught in English? Here's the trap. English medium doesn't mean English only life. Your academic classes may be in English, but the moment you step outside the classroom, Russian becomes useful. And once you start dealing with patients, knowing the local language becomes much more important for you. 13th question: do you really need Russian? Can you survive Russia without Russian? Maybe. Can you have the best medical experience without it? That's another question. I strongly recommend learning Russian from your first year. Even basic Russian makes everyday life easier. And as a medical student, communicate with patients is extremely important. So you have to learn Russian to survive in Russia. 14th question: how difficult is Russian? Russian looks terrifying when you first see the alphabet, but don't panic. The Cyrillic alphabet is actually something you can learn fairly quickly. The difficult part is building vocabulary and grammar. If you spend a little time every day, you will gradually become comfortable with it. And there is no language in the world which is difficult and you cannot learn. Next question: when does clinical exposure start? Here's something every future medical student should ask before admission. When exactly will I meet real patients? Don't just ask whether the university has a hospital. Ask when students actually enter the hospital, how often they go, what activities they perform, and whether they are observing or actually participating in the clinical. 16th question: is clinical exposure good in Russia? This is where the reality can sometimes feel very different. A university having a hospital does not automatically mean every student gets excellent hands-on experience. You should investigate the actual student experience, and once you are there, be proactive. Don't just stand in the corner of a ward. Go and ask to the nurse, ask to doctor that I want to learn something. So they will teach you. 17th question: do you learn injections and IV cannulation? Being a medical student doesn't automatically mean someone is going to hand you an IV cannula. Procedural skills need proper teaching, supervision, and practice. You should actively seek opportunities to develop them through your practical classes, stimulation, training, and supervised clinical exposure. Don't wait until final year to think about basic clinical skills.
तू समझा? हाँ. नहीं, तू समझा नहीं.
18th question, which is very important question. How are the exams? You know those students who start studying 3 days before the exam. Medical school is going to teach them a lesson. You will have continued academic pressure, and depending on the subject, assessments can include written, practical, and oral components. My advice is simple. Understand the subject throughout the semester instead of trying to memorize everything at the end.
बाल बाल बच गया रे देवा.
19th question. What happens if you fail? Failing one exam is not the end of your medical career, but ignoring your failures can become a serious problem. You generally get opportunities to clear academic deficiencies according to your university rules. The important thing is to identify why you failed and fix the problem before it affects more subjects. 20th question. How is hostel life? Your first Russian home probably would not look like your bedroom back in India. You have to adopt to shared living, different food, different rules, and a completely different environment. But hostel life can also be one of the best parts because you meet students from different countries and build friendships. And you will also get not different countries, I can say different states also of the India. So it is, we can say, joint. 21st question. How bad is Russian winter? If you are from India and you have never experienced a real Russian winter, forget everything. You think you know about cold. Your first winter can be shock, but once you have proper thermal clothing, shoes, gloves, and a good jacket, you adopt. Russian buildings are also designed for cold weather, so you learn how to manage it. 22nd question. What about Indian food? Let's be honest. Before parents ask about academics, many ask, "Beta, khana milega?" Indian food is available in many places with Indian student communities, and you can also cook if your accommodation allows it. But I would recommend learning to prepare some basic meals yourself. It saves money and gives you more flexibility in the nearby future also. 23rd question. Is Russia safe for Indian students? I'm not going to tell you Russia is 100% safe. That wouldn't be irresponsible. Like anywhere else, you need common sense. Know your surroundings, follow local laws, avoid unnecessary trouble, and keep your documents secure. Also stay updated about current travel and safety advisories. 24th question. Can you visit India during MBBS? Yes. You are not signing a 6-year prison sentence when you come to Russia. Students can generally return home during permitted breaks, provided their academic schedule and immigration documents allow it. The bigger issue is planning. Tickets can become expensive, especially during peak seasons. 25th question. Is the Russian university visa difficult? Student visa difficult. Admission letter in your hand doesn't mean your journey is finished. You still need to complete the visa process correctly. Your university generally provides the necessary documentation, and you then follow the current visa procedure. Keep your documents organized because immigration paperwork is something you don't want to take casually. What are the NMC rules? If you're spending lakhs on a foreign MBBS but have not read the NMC rules, you are taking a massive risk. Before admission, understand the current requirements for foreign medical graduates, course structure, duration, internship requirements, and the pathway to registration in India. And remember, the rules applicable to your graduating batch are what ultimately matter. 27th question. Can you practice in India after a Russian MBBS? A Russian MBBS degree is not a magic license to open a clinic in India. No, you have to fulfill the applicable Indian registration and licensing requirements after graduation. Your degree is only one part of the journey. Before joining, understand exactly what you will need to do after graduation.
आप कुछ भी बोलो, ये नहीं सुनने वाला.
28th question. How difficult is FMGE? If you're planning to prepare for FMGE only after finishing MBBS, you are already making your life harder. Start building stronger concepts from the first year. You don't need to study specially for FMG every single day from the first year, but you should understand your subjects from an Indian examination perspective and gradually build your preparation as well. 29th question. What's the dark reality of MBBS in Russia? Now I am going to tell you the things that probably would not appear in an admission advertisement. You will miss your family. Russian can be frustrating. Winter can be difficult. Administration can test your patience. Clinical exposure may not always meet your expectations. And after graduation, you still have to deal with the licensing pathway. But these challenges do not automatically make Russia bad. They are simply realities you need to be prepared for before going to Russia.
अच्छी बात बोली, आपको अच्छी लगी तो ऐसे थोड़ा मार दीजिए हाथ, आप थोड़ा सा मार दीजिए.
Would you recommend Russia to other Indian students? If my own younger brother asked me, should I come to Russia for MBBS? This is exactly what I would tell him. I would tell him, don't come because an agent says it's cheap. Come only after you have researched the university, understood the total cost, checked the current regulations, and accepted the reality of living abroad. If you are serious about medicine and prepared to work hard, Russia can be a good path. But it is definitely not an easy shortcut. So guys, that's it. And remember, I am not making this video to convince you to come to Russia or to convince you not to come. I am making it so that if you decide to come, you come with your eyes open, not because someone promised you an easy MBBS. So that were the 30 common questions that a normal Indian MBBS student or medical student wants to know.
शाबाश, काम कर रहा फटाफट आजकल तू. Very good.
And has to know these questions. So thank you. Let's meet in the next video. Till then, bye bye.